Hello, good evening everyone. This is Dr. Jambukesawarn, PrepLadder's orthopedic faculty for you. Am I audible and visible clearly? Hello, good evening everyone. This is Dr. Jambukesawarn. Yes, sir. Okay. Yeah. Yes, today we are going to see very quickly, because unnecessarily we should not take time, quickly the previous year question bank, past 5 years question bank of NEET PG. So we are going to rush quickly the questions so that it will be very easy for you. Suppose repetition is quite common in our PG entrances. Okay, so we will move on. Okay, we will move on. Yes, we will move on to the first question, dear friends. A 25-year-old man presents to the emergency department following a motorbike accident and is found to have a closed mid-shaft fracture of the left tibia. 6 hours later, he developed severe leg pain that is disproportionate to the injury. This is the point. Disproportionate to the injury. Whenever there is a pain, when a word comes disproportionate to the injury, the question is about compartment syndrome, otherwise called Volkmann's ischemia. Worsens with passive dorsiflexion. This is called stretch test. This is called stretch pain. Okay, very characteristic sign of compartment syndrome. The pain is not relieved by analgesic. On examination, dorsalis pedis and posterior tibial are present. That's one good sign, but there is no sensation over the first dorsal web space. Nerve compression is there, okay? So that numbness is there. That's called paresthesia. Paresthesia is present. Pulselessness is not there. Stretch pain is present. What is the most appropriate next step? That's the question. Okay, so what is your answer? Yes, many have answered. Good evening, sir. Parimala. Okay, drones and bus. Will. Okay, excellent, dear friends. Pankaj Singh, Sharada Shah. All of you have answered it correctly. The thing is, just I will discuss, elevate the limb and observe is not true because this is prevention. The first the choice A is prevention of compartment syndrome, not treatment of compartment syndrome. Okay, administer opioid analgesic and continue observation is wrong. This is also wrong. Apply cast and follow up. You should never apply cast when you are suspecting compartment syndrome. Even when already the patient is on cast, you have to remove the cast. That is the first step you will do. So obviously wrong. The best treatment is immediate fasciotomy. Okay, that's the right answer. Okay, yes, very good. Muttarasu has answered. Mutturasu have answered more than 20 to 30 mm Hg. Very good. Mutturasu, that is the compartment pressure. Normal intracompartmental pressure is 20 up to 10 to 20 mm Hg. Anything more than 20 mm Hg is impending compartment syndrome. Something more than 30 mm Hg is a direct indication for emergency fasciotomy. Okay, so this is that question. Question number 2, second question. A 60-year-old patient presents with pain in multiple bones, pain in multiple bones, and history of increased hat size. On examination, some bone feels warm to touch. Okay, and biochemical investigation shows normal serum calcium, normal phosphate, and normal parathyroid hormone, but markedly elevated alkaline phosphatase. What is the most likely diagnosis? Excellent, guys and girls. Superb. All of you have answered it correctly. Yes, this is a classical presentation of Paget's disease of the bone. Paget's disease. You see, dear friends, in Paget's disease, multiple bones are involved. Many bones are deformed. That is why Paget's disease is otherwise called osteitis deformans. When you take the microarchitecture, when you take a histopathological examination of the bone, when you view under microscope and when you see, you can see multiple microscopic arteriovenous fistulae, AV fistulae. AV fistulae means there is hyperdynamic circulation. Whenever there is hyperdynamic circulation, when you touch the bone, will feel warm. And hyperdynamic circulation is an important feature. That is why histopathological, the hallmark finding of Paget's disease of bone is mosaic pattern. It's called mosaic pattern. That's because of micro arteriovenous fistulae. So the patient will have hyperdynamic circulation. Whenever a patient has hyperdynamic circulation, pulse pressure will be wide pulse pressure. And these patients are prone for high output cardiac failure. So Paget's disease, the complication is high output cardiac failure. We should not forget all these parallel points. And classically, because Western books, they have the habit, they have the culture of wearing hat. The skull enlarges disproportionately. That is why the word they use is change in hat size. Okay, excellent. So everything is discussed in our, X-ray shows honeycomb pattern, flame, Paget's disease, it is blade of grass appearance, flame-shaped lesions, picture window frame, vertebra, everything we have discussed in our thing. Okay, just it's a brush up. Good. We will move on to the third question. Next question. A 20-year-old man presents with chronic back pain. That is worse in the morning, improves with physical activity. Whenever he gets up, it is worse in the morning and it improves with physical activity. That should be inflammatory arthritis. Inflammatory arthritis is of two types: ankylosing spondylitis, rheumatoid arthritis. In a male patient, ankylosing spondylitis is common. In a female patient, rheumatoid arthritis is common. Whenever you get up, the pain is less. When you start working, pain gets worsened. That is degenerative arthritis, that is osteoarthritis. So the history says it is inflammatory arthritis. He also has history of anterior uveitis, commonest association, ophthalmic association of ankylosing spondylitis. An X-ray lumbar spine shows no abnormality. Which of the following is the most appropriate next investigation? Clinically, clinically, yes, very good. Clinically, yes, excellent. So, on the ankylosing, yes. Clinically, we are suspecting ankylosing spondylitis. Clinically, we are suspecting ankylosing spondylitis. We are suspecting ankylosing spondylitis. And the investigation of choice, or the earliest investigation that will help your ankylosing spondylitis is MRI. Answer is MRI. Okay, it is MRI. Yes, good. All of you have answered it is MRI. Excellent. Yes, okay. Okay, right. Okay. Sir, why not CT scan? Norm, why not CT scan? See, CT scan is nothing but an improvised form of X-ray. It's an improvised form of digital X-ray. X-ray is not showing any abnormality. CT scan unlikely to show any abnormality. Whereas MRI, it can pick up much more earlier the lesion of ankylosing spondylitis than, because ankylosing spondylitis starts from the sacroiliac joint. The iliac side of sacroiliac joint. It starts from the iliac side of sacroiliac joint. So that will pick up the thing better than other investigations. Yes. So 10-year-old child presents with painless limp. This is a very important question. Painless limp. Based on the X-ray shown, what is the most likely diagnosis? The child is 10 years old. Thank you, Ram. Thank you. Yeah. So based on the X-ray, 10-year-old child presents with painless limp. What is the answer? Hey, dear friends, guys and girls, this is a very tricky question. Very, very tricky question. Please read the choices thoroughly, then you answer. Okay. So, yes, many people are discussing. So, this is really a tough and a tricky question. Please, okay. I don't know what the answer that is given in your that platform in your what I can say in the app. You forget everything. You concentrate on my teaching right now. The child's age is 10 years. That is grown up child. The child is presenting with absolutely painless limp. The first thing that should come to your mind is a neglected DDH. Neglected DDH. Absolutely, when somebody presents with, see, I will tell you the reason. Many of you are thinking this in terms of Perthes. I will tell you why Perthes will cheat you. This question will cheat you. I will tell you the answer. Neglected DDH is the commonest cause for a painless limp in a child around say 10 years. Because we all know developmental dysplasia hip happens from birth. If it is not treated for 6 months, more than 6 months, that automatically becomes a neglected DDH. You have to give the patient, the baby on a Pavlik harness, all those things we have discussed. So they will present to you with a painless limp. Why it is not Perthes? Perthes disease is nothing but avascular necrosis of the femoral head happening in a child. In avascular necrosis, in the early stage, definitely patient will have pain. So whenever, see, I will make it simple for you. Whenever a baby presents to you with a limp, okay, you just divide this into painless limp, okay, and painful limp. You divide this into two. The commonest cause for painful limp in a child is called transient synovitis hip. That is not there in the choice. Better you know. This is a standard clinical question, not much of theory. Practicals, no? For final year MBBS, in all hip cases, we teach this routinely in our clinics. Transient synovitis hip. That's the first differential diagnosis for a painful limp in a child. The second thing is early Perthes. Okay. Then the third thing for a painful thing is TB hip. That is also not there in the choice. So these are the three causes one should suspect in a painful limp in a child. If it is painless limp, the first thing they say it is developmental dysplasia hip. Developmental dysplasia hip. That is the commonest cause for a painless limp in a child. When you analyze these four choices carefully, Perthes they had mentioned, okay, they didn't use the word very late Perthes or something. And slipped capital femoral epiphysis always presents to you with very, very severe painful limp. It will never present to you with a painless limp. And osteomalacia will not present to you with limp at all. It won't present to you with any limp. Developmental dysplasia hip, the age is 10 years. The answer implies it is neglected developmental dysplasia hip. So the most appropriate answer for this is only this. This question is a very tricky question. Please read this question, the X-ray carefully. Have this in your mind. They may repeat this question. You know simple psychology of our PG entrance, dear friends. Whenever a question is repeated in the previous exam, many have answered it wrongly. When many have answered it wrongly, definitely they will repeat the question for the next time. So we should be very careful, and this is the correct answer. Definitely when this question comes and you answer it correctly, it will lift our mark. So focus, okay? Yes. We will move on to the next question. A 70-year-old female presents with chronic low backache. A lateral lumbar X-ray provided in this thing. Based on the radiological finding, what is the following is the most likely diagnosis? You look at this X-ray. When I see this X-ray, I will round it. I will mark it here. You are able to see something. Okay, I will erase now. You see, they are nothing but osteophytes. The age is 70, chronic low back pain. What it could be? Osteoarthritis of the lumbar spine. Osteoarthritis of the lumbar spine is called, osteoarthritis of the lumbar spine is called, yes, osteoarthritis of the lumbar spine is called spondylosis. It is called spondylosis. Spondylosis is the term for osteodegenerative change of the spine. Spondylosis. Spondylolisthesis is slippage of one spine over the other, and usually it happens in L5 S1. When you see here, you see this is S1, this is sacrum, okay, this is sacrum, this is lumbar spine. When you see, this will be shifted here, okay, there will be listhesis. Here there is no absolute listhesis, everything is normal. Only thing, the corners are showing osteophytes, which is nothing but degenerative change of the spine. Degenerative change of the spine. Yes. Hrithikant, Hrithiknath have answered it correctly. Very good. So it is, the answer is spondylosis. The answer is spondylosis. When you see here, all the vertebral bodies are of equal size. It doesn't show any fracture. Fractures of the vertebra, it will be showing wedge compression fracture. Okay. So the answer is spondylosis. Because they are presenting chronic back pain. Chronic back pain in a 70-year-old female or a male, one has to suspect the commonest thing. Common things common. Okay. Yes. In case of, if it is spondylolisthesis, dear friends, they will present you with acute pain, not chronic pain. Acute pain. Because one vertebra slipping over the another. Okay. So it will cause acute pain, not chronic pain. Yes. A 40-year-old man presents with discomfort on one of his joint. Synovial fluid aspiration reveals rhomboid shaped crystal, positively birefringent crystal under polarized light. Which of the following is the most likely? Obviously, a rhomboid shaped crystal with positive birefringent involving one joint. The answer should be excellent, dear friends. Most of you have answered it correctly. It is pseudogout. It is pseudogout. How many times you read this is worth reading. Every year they are repeating this question. See, this slide you should never forget. Pseudogout, the most common joint involved is knee joint. Pseudogout, it is knee joint. Okay. Pseudogout. Okay, it is knee joint. And it will show you calcium pyrophosphate crystals, CPP, calcium pyrophosphate crystals, and it is positively birefringent. It is positively birefringent. Positively birefringent. And the crystal shape is rhomboid shaped. This is about pseudogout. In gout, the most common joint that is involved is first metatarsophalangeal joint, and that is called podagra. The first metatarsophalangeal joint is called podagra, and the crystals, it's chemically composed of monosodium urate crystal, uric acid crystal, which is needle shaped, negatively birefringent. It is negatively birefringent. Okay, so one should not, I repeat once again, how many times you read, it will be worth reading. Pseudogout commonly involves knee joint. The crystals are made up of calcium pyrophosphate. The crystal shape is rhomboid. It is positively birefringent. In gout, the most common joint involved is first metatarsophalangeal joint, and that is called podagra. The crystals are chemically composed of monosodium urate. It is needle shaped, negatively birefringent. Please never forget these points. Okay, very important. We will move on to the next question. Yes. Okay. Yes. A patient suffers whenever there is a episode of more than 2 or more episodes within 12 months, that is called chronic gout. Only one episode within 12 months, that is called acute gout. Because acute gout, drug of choice you are giving is different, indomethacin. For chronic gout, you have to go for uricostic drugs. Okay, yes. So remember all these, recollect all these points quickly. A patient suffers an inversion injury of the ankle. Inversion injury of the ankle. Which is the most commonly, most likely injured part? Yes, very good. Sanvi, Harun, Pepsi, Dhriti, Bella, Sanat Singh. Okay. Yes, all of you have answered correctly. Marvelous. Very good. All of you guys and girls. The most common area that is affected, the structure that is affected is anterior talofibular ligament. Anterior talofibular ligament. Okay. So, anterior talofibular ligament. You see here, inversion injury of the foot. Inversion injury of the foot. Right. When you see here, the commonest structure that is torn is in inversion injury of the foot, it is anterior talofibular ligament. They will present you with severe pain on the dorsolateral aspect of the ankle. They will present you with severe pain in dorsolateral aspect of the ankle. Yes. What is the type of fracture healing you can expect in fracture treated with manner shown in the X-ray? In the X-ray, yes, wrist or injured on eversion injury. Yes, Sanat Singh has given a very good point. All these things are in the eversion injuries. Okay, this is in the inversion injury. Excellent. You see, what is the type of fracture healing you can expect? See, they had done a surgery, they had fixed a fracture with a rigid plate and screw. Rigid plate and screw. Okay, this again is a very, many of you have answered it correctly, but few of you have missed this question. I will tell you. See, when somebody has when they had fixed it with a rigid plate and screw, the type of healing, okay, please, fracture healing, let us revise in 1 minute, focus your attention. Fracture healing is of 3 types: primary healing, secondary healing, third type of healing is called distraction histiogenesis. The third type of healing is called distraction histiogenesis. When a fracture has happened, I have applied a POP, I have not done any surgery, a POP, and it is healing by its own naturally in 45 to 60 days time. That type of healing is called secondary healing. A fracture has happened, I am opening, fixing it with a plate and screw, or with a nail, or with some screw or nail, whatever it is, with an implant I am fixing rigidly. Healing is happening. That type of healing is called primary healing. Primary healing. When I heal a bone with Ilizaro's distraction, ring fixator, I am distracting slowly, so the periosteum is slowly stretched, which lay the bone underlying the stretched periosteum. That is called distraction histiogenesis. 3 things. Commonly, you should know the primary and secondary. When a healing happens because of an implant, that will be primary healing. When a healing happens naturally with POP, that is called secondary healing. In all aspects, secondary healing is superior because callus formation will be excellent in secondary healing. In rigid plate and screw, the callus formation is very less, primary healing. The only advantage of primary healing is perfect anatomical reduction and fixation. In secondary healing, minimal malunion may happen because perfect anatomical reduction is not possible if you don't open. Got my point? So the only advantage of primary healing is perfect anatomical reduction. That's the only advantage. In all other sense, 1, it has anesthesia complication. 2, expensive. 3, infection. 4, callus that is formed with plate and screw is not exuberant, external callus is not formed because plate is holding, only the bridging callus is formed. Okay, once you remove the plate, Once you remove the plate, the bone will have a good anatomical reduction, but external callus is not there. But so refracture is common. When you fall again, refracture is common. But when it heals with natural healing with POP, external callus will be there, so the bone is more stronger than in the primary healing. So these are the points you should revise very quickly. If they ask which healing is superior, obviously the answer is secondary healing. Okay, here since they had given a plate and screw, the right answer is primary healing. Okay, so please read the topic fracture healing. Okay, yes, very good. Primary healing, excellent. Okay, thus, okay, excellent. Yes, lower chance of malunion, good. We'll move on to the next question. Which of the following fracture can cause a deformity as shown in the image below? See, the image given here is wrong. The image they had shown is a cubitus varus type of image. Cubitus varus type of image. Okay. See, Irab Shaheen has asked a doubt. Row 6, sir, so the best type of healing is secondary. Obviously, Rose, the best type of healing is secondary. Okay, it is secondary. And Hirab has asked me a doubt. Sir, so what is creeping substitution, sir? See, Irab Shahin, it is for you. See, creeping substitution is a terminology in healing, Irab. You see here, whenever in all other tissues, okay, in all other tissues, when an injury happens, healing is by fibrosis. Healing is by fibrosis. Whereas a bone has fractured, healing is not by fibrosis. It is again by a bone tissue only. For that, the terminology is called creeping substitution. I think I am clear, Irab. Just give me a thumbs up sign, Irab, if you are satisfied with the answer. Hello? Yes? Irab, are you there? Yes? Irab, you asked a very, very valuable doubt, creeping substitution, so that everybody is benefited with the thing. Yes? Okay. So, originally speaking, this image is wrong. In that exam, the image was given as cubitus varus. Cubitus varus, gunstock deformity. Okay, gunstock deformity. So, gunstock deformity, which fracture causes gunstock deformity? That is the question. Gunstock deformity, which fracture? Gunstock deformity is most common cause for gunstock deformity is a malunited supracondylar fracture of the humerus. Supracondylar fracture of the humerus. Yes. Okay. Okay. Yes. Good. Okay. Right. Okay. So we will move on to the next question. Linear growth of the bone. Linear growth of the bone is disturbed when a fracture occurs in which of the following location? Linear growth is which of the following location? Right. Linear growth is affected. Which area is affected? Obvious. The answer is very simple. D. Marvelous. All of you have answered. Whenever there is a disturbance of the epiphyseal plate, linear growth is affected. Epiphyseal plate, otherwise called growth plate. Otherwise called growth plate. Very good. Saltram Harris. Marvelous. Thus, you have answered Saltram Harris. Okay. Because this epiphyseal growth plate is composed of few layers. One layer is called hypertrophic layer. Next is calcific layer. Third is a resting layer. Fourth, there is something called proliferative layer. Whenever there is injury, even in these layers, micro level, whenever there is injury to the hypertrophic or calcific layers, it won't cause any growth arrest. It won't cause any growth arrest. But when it involves the proliferative zone, 100% will end up in growth arrest. So this is about this question. Good. And yes, so this depends upon our Saltram Harris classification. We know that. Yes. We'll move on to the next question. Which area is affected by the fracture shown in this given X-ray? The X-ray shows here a fracture. Which is that? What is the area? What is the area? What is this area? Yes? Shall I tell the answer? This again is a very slippery question. Very slippery. See, dear friends, focus your full attention. Please focus your full attention. Right? The whole this area is called, this is called tibial condyle. Whole thing, it is called tibial condyle. Okay. So they have not marked there tibial condyle. When you focus here, you are able to see a small avulsion fracture on the lateral aspect of the condyle here. This is called Gerdy's tubercle. This is called Gerdy's tubercle. This is called Gerdy's tubercle. This is spine of the condyle. This is Gerdy's tubercle. Okay, so this is a Gerdy's tubercle fracture. This is a Gerdy tubercle fracture. And Haroon Sifi, marvelous Haroon, he has used the word Seagond. It is called a Seagond fracture. It's called a Seagond. Okay, it is there now. Thing is called Seagond's fracture. Name of the fracture is Seagond. Anatomical structure, that area is called Gerdy's tubercle. That's called Gerdy's tubercle. Marvelous, very good. A man presents with back pain following road traffic accident. There was no history of neurological deficit. CT spine is done. What is the diagnosis? Which of this fracture definitely will not cause any neurological deficit? Answer is very simple. Road traffic accident, patient is having back pain, no neurological deficit. What is the common cause? What is the common cause? Chance. See, many of you are answering that as chance fracture. No, dear friends, chance fracture is example of seat belt injury. It's a kind of whiplash injury. Okay, chance fracture. That is not the answer. The answer is wedge compression fracture of the vertebra. Wedge compression fracture, it's called compressed fracture. They are given. What they are meaning is wedge compression fracture. Wedge compression fracture of the vertebra. Wedge compression fracture of the vertebra. Okay, vertebra, right? So, wedge compression fracture of the vertebra, the only presentation is back pain. 100% that will not cause any neurological deficit. Treatment for that is not surgery. Just you have to give a lumbar brace and rest. Automatically it will heal. That's all. Okay, wedge compression fracture of body of the vertebra. That is the answer. Okay. Yes. See, drones bus, you are asking a question, history of accident. This is how they will frame a question. Road traffic accident means just it's a very, very broad road traffic accident. Anything that happens on the road is a road traffic accident. You are walking on the road, not necessarily a run over should happen with a lorry or a four-wheeler. You are falling on the road, it is a road traffic accident. Anything which is happening inside your compound wall, that is called domestic accident. Okay, this is how they will mislead you. So we should know which point to pick up. In this question, the point we have to pick up, no history of neurological deficit. No history of neurological deficit. That's what. So chance fracture will present to you with neurological deficit. Spinous process fracture may present, you go and check the book, may present with fracture base of the vertebra, very, very dangerous. Base of the vertebra, it will cause cord compression, immediate paraplegia. So all these chances of neurological compression may be there, but here compressed fracture of the vertebral body, which is called wedge compression fracture, there is no chance of neurological deficit. This is how we should assess in a given time. Okay, that is why our thing just came across a video. I was his student currently in final year. If MD, forever grateful. Oh, Swapan Singh just came across sir's video. I was his student currently in final year MD. Oh, hello, dear physician. Congratulations, Swapan Singh. Okay, physician. Okay, which college you are doing now? Which college you are doing now? Sing. Which college you are doing MD? Excellent. Okay, I feel very happy. Okay. Yes. I am chatting with my old students also. I feel very happy. Sing. Yes. Okay. So wedge compression fracture. We'll move on to the next question. Yes. Next question. A child presents with growth failure. A child presents with growth failure. Biochemical analysis shows normal calcium, normal parathormone, reduced phosphate, increased alkaline phosphatase. What is the most likely diagnosis? This is a cake question. This is a cake question. Okay. Yes. So only phosphorus is low, calcium is normal, alkaline phosphatase is elevated. So this should be a case of hypophosphatemic rickets. Hypophosphatemic rickets. Hypophosphatemic rickets is otherwise called renal rickets, otherwise called resistant rickets. Resistant rickets. When you take the Harrison, when you read, he has given a line like this. In our country, in India, the commonest cause is nutritional rickets. Worldwide, the most common cause nowadays is renal rickets. It is renal rickets. Yes. X-linked dominant condition. What is that? X-linked dominant condition. Very good. Yes. Fix gene. Marvelous. Marvelous. Superb. Now, a footballer had a twist in the ankle and knee. Clinically, no bony injury was appreciated. The examiner is performing a test to assess the knee joint. What is this test? Which test he is doing? Okay, which test he is doing? Very good. Okay, which test he is doing? He is doing, you look at that. See, dear friends, focus your full attention on me, please. Patient is lying in supine position. Knee joint is flexed to 90 degree. I am sitting over, the examiner sitting over the foot of the patient. Just I am pulling the tibial tuberosity anteriorly like this. This is called anterior Drawers test for ACL. If I flex the knee joint only to 30 degree, that is called a Latchman. When I flex it to 90 degree, anterior Drawers. 30 degree, it is Latchman. So this is very, very important, dear friends. Excellent. Okay. So we will move on to the next question. So this is anterior Drawers test. Latchman, the knee joint only, it's moved only to 30 degree, not 90 degree. Okay. Yes. An 8-year-old male child presents with fever and tenderness in the left lower limb. The limb is warm on touch and ESR is raised. An X-ray reveals periosteal elevation. What is the diagnosis? See, ESR raised, patient warm on touch. Okay, so it should be a case of osteomyelitis, acute osteomyelitis. It is osteomyelitis, acute osteomyelitis. That is the cause. Ewing sarcoma happens in the diaphysis, but it is not warm on touch. Okay, osteogenic sarcoma uncommon in an 8-year-old child and it happens only in the metaphyseal area. Right. Giant cell tumor will never show you periosteal reaction. Okay. Yes. Now, which classification is used for the following fracture and what is the stage? They are given a fracture. They are asking what classification, what is the stage? Very good. Marvelous. All of you have answered it correctly. The answer is Gartland's type 2. See, I am seeing a supracondylar fracture. In supracondylar fracture, the posterior cortex is intact, only the anterior cortex is open. So this should be Gartland's type 2. Okay, it should be Gartland's type 2. Let us quickly revise. The classical classification system for supracondylar fracture is called Gartland's. Type 1, hairline fracture and undisplaced. Type 2, complete fracture, posterior cortex is intact, anterior cortex is displaced, open. Type 3, both anterior and posterior cortex, everything is totally, completely displaced. Okay, completely displaced. Okay, so Gartlands, please never. Okay, so yes, now it is okay. Blurring. Focus. Yes, I think now it has become all right. Okay, okay, yes, yes. Now identify the orthopedic implant that is shown in the image. They had asked this question twice. Orthopedic implant shown in the image. What is this called? What is this called? Very good. Marvelous. All of you have answered it well. This is called dynamic hip screw. This is DHS, dynamic hip screw. Dynamic hip screw, see, dear friends, this is DHS. Okay. Another implant that can be used is PFN, proximal femoral nailing. Two things. Two implants are used for intertrochanteric fracture. Two implants are used frequently for intertrochanteric fracture. One implant is called dynamic hip screw. Another implant is called proximal femoral nail. Dynamic hip screw is used for undisplaced, that is type 1. What is the classification system for intertrochanteric fracture? Boyd and Griffin. In Boyd and Griffin's type 1, type 2, DHS can be used. There is a pattern called reverse oblique. For that, only PFN can be used, not DHS. That's all. Okay. So, intertrochanteric fracture, it's very, very important. Yes. Good. We will move on to the next question. A patient presents with fifth metatarsal fracture. This is called Jones. For how many days he or she should wear that POP cast? Jones fracture, how long it will take generally speaking? Lower limb fractures. Very good, very good. All of you have answered it excellently. Everyone is answering 6 to 8 weeks. Marvelous. That's the right answer. Okay. Then a 5-year-old child was brought with bony deformities. Bony deformities are there as shown in the radiograph. So this is called bow leg. This is called bow leg. Due to deficiency of which of the following? Okay. Yes. Marvelous. All of you have answered it correctly. It is due to vitamin D deficiency. This is nothing but rickets. Nothing but rickets. Genu varum. Genu varum. That's all. Okay. This is genu varum. Okay. Marvelous. In which of the following nerve injury is this? It is instrument is a wrong word. Appliance. That's the correct word. The question bank they had supplied as instrument to me. The original word is appliance or splint. Okay. Shown below used. So this is nothing but your dynamic cock-up splint. Dynamic cock-up splint. This is nothing but dynamic cock-up splint. You all know this is used in radial nerve palsy, wrist drop. Okay, this is used for wrist drop. That's all. Marvelous, guys. All of you have answered. Okay, it's a cakewalk for you. In the orthopedic outpatient department, a female patient, first point, presenting with difficulty sleeping at night due to experiencing numbness and tingling in the outer 3 digits of their hand. The symptom improves when the patient hangs the arm from the bed. Which of the following choice accurately identifies the patient's condition and test employed to evaluate it? So the history in a female, this suggests what is called carpal tunnel syndrome. This is a case of carpal tunnel syndrome. Okay. So what the test you will do? Yeah, everyone are answering it correctly. Marvelous. The answers are correctly. The answer is carpal tunnel syndrome and the test is called Durkheim's test. Okay. So that is the right answer. That is Durkheim's test. Okay. You see here, carpal tunnel syndrome Please focus your fullest attention. Carpal tunnel syndrome is compression of median nerve happening in the carpal tunnel. Compression of median nerve happening in the carpal tunnel. The most common structure that is involved in carpal tunnel syndrome is median nerve because that is the most superficial structure. Most common cause of carpal tunnel syndrome is physiological, that is pregnancy and menopause. That's the commonest cause. Since most of them are female related problems, carpal tunnel syndrome commonly happens in females. The second cause, an important pathological cause for carpal tunnel syndrome is hypothyroidism, otherwise called myxedema. The third important cause for carpal tunnel syndrome is rheumatoid arthritis. Fourth important cause for carpal tunnel syndrome is a malunited Colles fracture. Fifth important cause for carpal tunnel syndrome is called compound palmar ganglion. Compound palmar ganglion, it is due to tuberculosis and it's common in our country, which will compress the carpal tunnel. So the classical presentation is pain and tingling sensation along the course of the median nerve, sometimes the 3.5 digits of the hand, which improves when you hang your hand loosely. And most of the time the pain and numbness gets worsened during night time. The classical clinical test for carpal tunnel syndrome is called ask the patient to do like this and hold both the hands in this position for 1 minute. If it is carpal tunnel syndrome, excruciating pain happens along the course of the median nerve. This test is called Phalen's test. Phalen'', Phalen's test. Another test is you compress directly with your thumb, you compress directly over the median nerve in the carpal tunnel. If I am having carpal tunnel syndrome, excruciating pain develops within 1 minute. This test is called Durkheim's test. This test is called Durkheim's test. Okay. Very good. We'll move on to the next question. What is the probable diagnosis for a child brought to the orthopedic OPD with lower limb deformity and hyperpigmentation? Lower limb deformity, hyperpigmentation, skin lesions based on the present. They had given an X-ray, they asked what is the diagnosis. Very good, dear friends. All of you have answered it correctly. Marvelous, dear friends. This is called Shepherd-Crook deformity. Shepherd-Crook deformity. This is called Shepherd-Crook deformity. And Shepherd-Crook deformity happens in fibrous dysplasia. Fibrous dysplasia along with hyperpigmentation of the skin. This is called McCune-Albright syndrome. McCune-Albright syndrome. McCune-Albright syndrome. Okay. Very good. Okay. Ranjan, TNI Ranjan has answered all of you. Okay. Komikan, superb, marvelous. Okay. Muttarasu is telling that usually they may present with bilateral renal artery stenosis. You are right. So the child may present to you with unexplained hypertension. Uttarasu. Good. 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 Yes. Now, what could be the most likely diagnosis based on the X-ray image of a 22-year-old female? This is a classical X-ray of the distal radius showing a soap bubble appearance. Soap bubble. So, it should be a case of giant cell tumor, otherwise called osteoclastoma. Osteoclastoma. Okay. So, osteoclastoma, dear friends, focus your full attention. Osteoclastoma is otherwise called giant cell tumor. Histopathologically, it shows multinucleated giant cells. Most common site is around knee joint only. And another important site is distal radius. It is slightly more common in females. And it presents with the classical soap bubble appearance. Absolutely, there won't be any periosteal reaction. Best thing is you have to curate it out, the whole thing, curate it out and cauterize the walls. Drug of choice for giant cell tumor osteoclastoma is denosumab. Denosumab, you all know, monoclonal antibody. Denosumab, it increases the maturation time of osteoclast, so reduces the osteoclastic activity. So if they ask the question, drug of choice for osteoclastoma or giant cell tumor, denosumab. Treatment of choice is surgery. Treatment of choice is surgery. Okay, side by side, yeah, excellent. Okay, it is, you have given eggshell crackling, marvelous. Okay, yes, very good, marvelous. So side by side, we should revise all these points. We'll move on to the next. A woman during her routine examination presents with the following X-ray. What is her most likely diagnosis? Look at the X-ray. This X-ray shows, okay, ring shape lesion here, 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 here. Okay, all the digits it's showing. I will erase, you see here now. So this is nothing but multiple enchondromatosis. Marvelous. Multiple enchondromatosis, otherwise called Olier's disease. Olier's disease. Multiple enchondromatosis, otherwise called Olier's disease. Okay. Alia Khan, Maffucci syndrome, you had answered. Alia Khan, it is again, Maffucci syndrome is whenever there is multiple enchondromas associated with hemangioma, that is called Maffucci syndrome. Only multiple enchondromatosis, that is called Olier's disease. Okay, one very important thing, hemangioma, no, this Maffucci syndrome is a precancerous condition. It is a precancerous condition. Yes, multiple enchondromatosis, Olier's disease. Okay, yes. Which of the following is true about the type of fixation shown in the image? They had asked this question one time very recently. Okay, what is this? They had put some fixators in the tibia. So this is called two rods are there. This is one external fixator. This is another external fixator. So two rods are there and they are doing something like that, distracting. This is called spanning. This is called spanning. And it is fractured tibia with a spanning fixator. It's called a spanning fixator. Usually we will use this around ankle joint, ankle spanning, knee spanning, around joints. Okay, ankle spanning, knee spanning. So it's fractured tibia, spanning fixator. Same questions may come. Okay, all these questions you should have in your mind. A male patient presented with fracture of the tibia following a road traffic accident. He was managed appropriately, but after 2 days, he developed dyspnea, petechiae, and fall in oxygen saturation. What is the diagnosis? Obvious, yeah, all of you have answered it. This is called fat embolism. Okay, don't forget the word Gerd's triad. In fat embolism, Gerd's triad. Number 1, hypoxia. Okay. Number 2, mental confusion. Mental confusion unrelated to head injury. That word is very important. Mental confusion. Third thing, petechial rash. Petechia. Okay, petechiae. So petechial rash. Yes, marvelous. Okay. Ranjan Parvat Godra. Gerd's triad. Very good, Dr. Pepsi. All of you have answered. That means you had read well. Marvelous. Okay. Deepika. Okay. All of you have answered correctly. Marvelous. This is Gerd's triad and one should not forget fat embolism. An intrauterine scan at the 13th week of pregnancy shows fetus with multiple long bone fracture. What is this? What it could be? The only cause one has to suspect is multiple fractures. Okay, very good. All of you have answered. It should be osteogenesis imperfecta. Osteogenesis imperfecta, which is a fatal disease when it happens in the intrauterine life most of the time during delivery. During delivery, it may cause all rib fractures and the newborn may be a dead born baby. Okay, it may stillborn, right? So it is a very dangerous condition, osteogenesis imperfecta. Osteogenesis imperfecta is the classification is called Sillon's classification. Type 2 has the worst prognosis and you know it is associated with blue sclera. So it's called blue sclerotic. The sclera is thinned out because it's a collagen disease. Since the sclera is thinned out, the uveal pigments behind the sclera is seen very easily. The color of the uveal pigment is dark blue, so the eye appears blue. That's called blue sclerotic. And when you see the teeth, there will be irregularity, so it's called dentigerous imperfecta. Okay, so all these things side by side you should recollect. In our main video, go through osteogenesis imperfecta once. Okay, yes, osteogenesis imperfecta, as you said correctly. Okay, Tina Ranjan, it is called brittle bone disease. Very good. Yes. Sura Kholi, can it happen in neonates? Yes, it can happen in neonates. Okay. The certain classification I had given in the type 1, type 2. Type 1, either it presents during birth or during neonatal period. Type 2, it presents only in the adult life. Okay. So there is a classification system. You kindly go through all those things. Yes. Yes. And Dr. Maggie has given another important point, different stage of healing. Yes, because different stage of healing comes in osteogenesis imperfecta. Because the closest possible differential diagnosis for osteogenesis imperfecta is battered baby syndrome. Battered baby syndrome is because of it is child abuse by the caretaker, okay, by the parents, caretaker. So battered baby syndrome is the closest possible DD for osteogenesis imperfecta. Osteogenesis helps us by giving, when you just take a X-ray, different age of healing. That means all fractures won't happen at the same time. One fracture may happen 30 days before, another fracture today, another fracture happens another 20 days later. So the X-ray will show multiple age of healing. It says osteogenesis imperfecta. Marvelous. Very good. Excellent. We'll move on to the next. What is the most common late complication of this condition? So when you see this X-ray, I am seeing a supracondylar fracture. What is the most common late complication? This is a cake question. Everyone knows the most common late complication of supracondylar fracture is cubitus varus, otherwise called gunstock deformity. Gunstock deformity is a static deformity. It's very ugly looking like this. Gunstock deformity will be looking like this. Carrying angle is decreased. When carrying angle is decreased, it's called cubitus varus. When carrying angle is increased, it's called cubitus valgus. So for this, what I have to do, the best procedure is lateral closed wedge osteotomy, and that is called French osteotomy. That is called French osteotomy. French osteotomy, best procedure. Okay, yes. Okay, yes. Very good. A boy falls on the left shoulder. Okay, somebody is walking, a boy falls on the left shoulder and presents with the emergency department shoulder pain. His left elbow is flexed and is supported by the right hand. Which is the common bone that is fractured? This is very simple. Very good. Okay, very good. Okay. Look, Maggie, Pernikar, Bella, Darshan, all of you are answered. Marvelous, man. So fall onto the same side shoulder. The common bone that is fractured is clavicle. Marvelous. Superb. Okay. It's very simple but a cute question. Yes. What is the most probable diagnosis for a 20-year-old male presents with have been experiencing low backache and morning stiffness for 2 years along with bilateral heel pain? This is one of the recent NEET PG questions. Okay, recent NEET PG. Morning stiffness, low backache, bilateral heel pain. This is called plantar fasciitis. Plantar fasciitis. The commonest association, okay, in a male, no? So chronic back pain. This should be a case of ankylosing spondylitis. Ankylosing spondylitis. Marvelous. Okay. All of you have answered it. Okay. Kritik Kant, all of you have answered it. Marvelous. Ankylosing spondylitis. Dear friends, please focus your full attention. Ankylosing spondylitis comes under what is called spondyloarthropathy. Spondylo is vertebral column. Spondyloarthropathy, other joints. So it involves the spine, it involves the sacroiliac joint, and it can involve other areas, especially even costochondral joints. That is why chest tightness will be there, chest expansion will be reduced. Commonest extraskeletal associations are anterior uveitis, the eye, conduction defects in the heart, dissecting aneurysm in the heart, then it can cause what is called plantar fasciitis. Plantar fasciitis. Whenever the patient gets up from the bed, first step when he keeps, severe pain is produced along, burning sensation, pain produced in the plantar aspect of the foot, which is a very, very common association of ankylosing spondylitis. Okay, so ankylosing spondylitis, bamboo spine, all points you know, all those points you know. Apart from the bone, it will involve the ligaments and the soft tissue. That is why ankylosing spondylitis is otherwise called enthesopathy. It is otherwise called enthesopathy. So one of the soft tissue that is commonly involved is plantar fascia. It will also undergo inflammation. HLA-B27 positive. And the best drug you can give is sulfasalazine. Okay? Yes, good. The following test is done to assess. What is this test? What is this test? Yes, what is this test? This test which, very good, all of you have answered. What is this called? See, ask the patient to clasp both the fingers, all the fingers. If I am having, for example, right side median nerve injury, I can flex all the fingers except the index finger like this. This is called pointing index, otherwise called Ochsner's clasp test. This is nothing but an Ochsner's clasp test. Okay, otherwise called pointing index. Pointing index, which is characteristically the nerve that is damaged is median nerve. The nerve that is damaged is median nerve. Marvelous, very good, superb. Now, a 28-year-old male with gradual progressive swelling around his wrist joint for 3 months. Image of the swelling given below. What is the probable diagnosis? So I am seeing an osteolytic lesion in the distal radius. The same question is repeated, man. So it is osteoclastoma, otherwise called GCT. Very good. Osteoclastoma, otherwise called GCT. Marvelous. Okay, superb. Very good. Yes, good. Yes. Shall we move on to the next question? What is the probable diagnosis for a patient who is brought to the hospital after a road traffic accident complaining of pain around left hip joint and found to have a flexed hip, adducted hip, internally rotated hip? Yes, marvelous, all of you have answered. The answer is posterior dislocation hip. In posterior dislocation hip, it is flexion, adduction, internal rotation. In anterior dislocation hip, flexion, abduction, external rotation. Okay, very good. Feather is for posterior dislocation, Faber is for anterior dislocation. One should not forget. Again, this is a very favorite area of NEET PG, dislocation hip. Okay, in central dislocation hip, you cannot see any change in attitude of the lower limb. When you do a perirectal examination, you can palpate head of the femur in the rectum. That is central dislocation hip. So hip dislocation, posterior, anterior, central. Commonest dislocation is posterior. The attitude is flexion, adduction, internal rotation. Very good. Yes. We will move on to the yes. Marvelous. All of you. Sciatic, most common nerve that is damaged is sciatic nerve in posterior dislocation. Most common nerve that is damaged in anterior dislocation is femoral nerve. Most common mode of injury of posterior dislocation hip is dashboard injury. Very good. Superb. And vascular sign of Noreth will be positive in posterior dislocation hip. Excellent, man. Excellent. Yes. Real revision we are doing. All of you are answering very well and I feel very happy. Yes. As the intern, this is a very vague question, a recent question I had come across. As the intern on duty, your responsibility includes attending to patient involved in road traffic accident. Identify the patient from the options below for whom you would promptly contact orthopedic resident on call. They are given 4 choices. Try to answer. Read the 4 choice. This is a vague question, but very practical, very practical. Answer is simple only. Yes. Try to answer. Very good, very good. Okay. See, yes, most of you have answered it correctly. Patient with recurrent shoulder dislocation is not an emergency. Patient with fracture arm with capillary refill time less than 3 seconds. This is the thing which has to be given the very immediate thing. Okay, when you compare, because it's going for vascular compromise, immediately something has to be done. It's a very vague question, right? A maid is playing with a child by spinning him while holding his hands. A few hours later, the child starts crying, does not use his arm, and does not let anybody to touch him. What is the possible diagnosis? What is it called? What is this condition called? Yes? Very good. Yes? Answer. Yeah? Yes, sir, but 5 seconds more than 3 capillary refillings. Yes, the right answer for this, yes, it is called pulled elbow. It is called pulled elbow. What is pulled elbow? Pulled elbow happens in child around 4 years of age. What is pulled elbow? It is slippage of radial head from the annular ligament. Okay, it is slippage of the radial head from annular ligament. So the child will have limitation of supination. The child will present you with a prone forearm, very painful. The treatment for that is an OP procedure. Distract the child, just press the radial head and do a slight supination, that will get reduced. Okay, so it is slippage of radial head from the annular ligament. That's called pulled elbow, and this is otherwise called nursemaid elbow. This other is called nursemaid elbow. Very good. Okay, yes. Sir, can you please explain? Nursemaid, yes. Sir, feeling anxious for NEET. Please help. Okay. Author cock. Okay. Feeling anxious. The previous question you want, you see. We will go back to the previous question. See, patient with a fractured arm with a 10 centimeter long incision over the arm. This is not an emergency because already he is having a 10 centimeter long incision. It is just a compound thing. 10 centimeter, what he is saying is already fasciotomy has been done. Fasciotomy means the injury has caused a fasciotomy. So he will not go for compartment syndrome. He will not go for a compartment syndrome. Patient with fractured arm with capillary refill time 5 seconds in his fingers. This is, when you compare this fractured arm with capillary refill time less than 3 seconds in his fingers. When you compare this B and D, this carries more weightage. In the module, probably they had given this as an answer, but I am telling this is more relevant answer. 3 seconds, less than 3 seconds, this is time of 5 seconds. Okay, capillary refilling time. Okay, so please wait for a minute. Okay, I'll wait. Dear, okay, yes, okay, yes. Dear guys and girls, please forgive me a small change. You see, here this recurrent shoulder dislocation obviously is not the answer. C is obviously not the answer. The patient with a fractured arm with capillary refill time less than 3 seconds means comparatively this is, see, the textbook says 3 seconds, 2 seconds, 3 seconds capillary refill time is borderline. But here you see the patient with a fractured arm with capillary filling time of 5 seconds. So this should be the right answer. This is at more risk of vascular compromise than this. I am sorry. Okay. So this is the right answer is D. It is not B. It is not B. Thank you. Thank you for helping. Yes. So this is pulled elbow, right? What is the probable diagnosis for a C? Why not? Your answer D is right. Okay. See, you asked a thing. No, somebody said that, sir, feeling anxious. Orthocoxeling, sir, feeling anxious. Yes. Once I finish the few questions, no, I'll come back to you. Okay. I'll come back to you. I can understand your anxiety. I know how painful it is, how difficult to tide over this situation, especially this last month, this last few days. Okay, I will just tell what to do. Okay, please wait. What is the probable diagnosis for a patient who was admitted to a intensive 48 hours? This is a classical time after a fracture. Saturation of oxygen, rebreathing unit 100, but SpO2 remained only 60. The patient also experienced confusion. Chest radiograph shows clear lung field. It doesn't matter. In all cases, it won't show. Patient is admitted to the intensive 48 hours after fracture of femur. This is very important. Most common fracture that predisposes to fat embolism is fracture shaft of femur. Okay, fat embolism. Right. And oxygen saturation, but SpO2 remained only 60. Very, very less. SpO2 is very less. So among the GERDS criteria, it is satisfying two things. Patient experienced confusion. Mental confusion is there. Hypoxia is there. Not necessarily all chests should show the classical snowstorm appearance. Not necessarily. So this is obviously a case of fat embolism. Yes. Very good. Now, what is the method of scoliosis measurement portrayed in the thing? What is this angle they are asking? The scoliosis is there. They are measured with an angle like this. What is this angle to measure the scoliosis? Very good, all of you. The right answer is Cobb's angle. Cobb's angle. It should not be more than 30. Cobb's angle. More than 30, it needs surgery. Bowler's angle. Bowler's angle is for calcaneal fracture. Calcaneal fracture. Okay. Bowman's angle is for supracondylar fracture. This is for supracondylar fracture. Okay. Yes. Why there is confusion in fat embolism? Surakholi. Why there is confusion? See, oxygen saturation is low. Obviously, hypoxia to the brain. So they will have mental confusion, mental cloudiness. That's all. Okay. Yes. Very good. So what is the probable diagnosis for a 30-year-old female who presents with tumor located in the knee joint as shown in the provided biopsy image? The biopsy, what they had shown this, no? They are the multinucleated giant cells. Obviously, the answer should be giant cell tumor, otherwise called osteoclastoma. Okay, giant cell tumor. They had given this in the Q bank of ortho. I don't know whether this came in ortho or pathology, I don't know. But this shows multinucleated giant cell. So this is a case of giant cell tumor. Now, a patient presented with pain in the hand. The joints involved were proximal interphalangeal joint, distal interphalangeal joint, and first corpo-metacarpal joint. Wrist is spared. Okay, and metacarpal joint spared. What is the most likely diagnosis? When wrist is spared, okay, when wrist is spared, the diagnosis should be, yes. When the wrist is spared, diagnosis should be, very good. Deepika, Palani, Comicon, all of you. Okay, when the wrist is spared, the joint that is involved in the condition is osteoarthritis. It is osteoarthritis. When the wrist is spared, it is osteoarthritis. Good. Okay, so that completes the Q questions, roughly 45 questions. Okay, so you said, few of you said that chatting, feeling anxious. I can understand your pain. All of this situation already I have encountered, and I know the real pain in you. What to do now? So today's date is say almost 3rd is over. Roughly say 25 days more we can take in that way. Shortest thing 25 days. See, don't read new things. My advice is okay. My advice is, please don't try anything new. Don't read any new things. Just go through the things which you have read. I am telling you, dear friends, I had written so many entrance. Okay, first I finished, see, to be open with you in a YouTube I am discussing. Straight away I didn't get my MS Ortho in first attempt. If I have got MS Ortho in first attempt, I have no eligibility to advise you because I had never tasted failure. Who has the eligibility to advise people? One who have tasted success and failure equally. Then only he has the eligibility to advise, do this, don't do this. I have tasted equal number of failures and success in my life. Okay. Those who have tasted only failure also has no eligibility to advise people. Okay. See what I am telling, dear guys. Don't try anything new in this juncture. Just take your book. Just read your notes, whatever you had read, just go through once very quickly. Okay. The subjects you should give maximum importance at this time, what I can tell you, out of 19, right? Short subjects go through quickly. High yielding. SPM is high yielding. OG is high yielding. Anatomy is high yielding. Biochemistry is high yielding. These subjects are very high yielding. Last minute revision of these will help you a lot. I am telling, this is practically, it is not given in any book. This is my experience because I had written, first I got a diploma in ortho. Then I tried, then I got my MS Ortho. I had written few good entrances, got good rank in this country, and I know that what I can say. The exam name from All India has changed to NEET. That doesn't matter. Okay, but the concept, everything, the core thing is the same. Okay, these are the subjects you should finish, should go for a quick revision in these 25 days. Okay, major subjects, Anat, Biochem, SPM, OG, then 8 short subjects, 12 subjects first. After that, you can go through the other things. In these 12 subjects, out of 19, these 12 subjects, you should have everything in fingertips. SPM is such an important thing. Okay, so by your by the way you answer everything, okay, it says that really you people are hardworking. Almighty is there, will help us. Okay, be positive. Definitely we can crack this time. Definitely, I have 100% confident that my guys and girls, we will do this time. Okay, we will crack this time. Okay, all the best, dear guys and girls. Thank you so much.